Welcome back to your third video. I hope all is going well. At this point of the time of the game, you should be able to get close to 90, almost 100 degrees. So this is where we throw some more strengthening into your program. And at this point, you should be planning to go to outpatient physical therapy around the beginning of the third week. You don't want a long transition from home health to outpatient. You want a smooth continuance of care to make sure that you get this knee replacement done perfectly and with the best outcomes possible. So carrying off of last week's video, we're going to use sidestepping again, but we're going to put a band around, and you can ask your therapist, or if you have one of them at home, that works too. All you're going to do is, you may need to sit down to put this on, but all you're going to do is sidestep it now with the band. This is going to work your side hip muscles, hip abductors, which are going to create stability for your new knee. Okay, we'll do this for 60 seconds, 3 times per day. Second exercise, you may need to do this in the bed. We're going to work on a straight leg raise. So the most important part first is squeezing your thigh muscle, squeezing your thigh before you lift your leg up. And you want the legs to be pretty even at the end of the motion here. Squeeze, lift, squeeze, lift. We'll do this 10 times, 3 times per day. And I would encourage you to do all this on both sides, just to make sure you're staying strong. The third exercise is a bridge. It may be hard to do this in bed to get your knees bent like mine, and it's okay if you're a little further out. All you're going to do is lift your hips up, trying to squeeze your hip muscles, and come back down. We'll do this 10 to 20 times. You may feel your hamstrings cramping up, and that's okay. Shake it out, let it relax, and then try to get back to the movement. That is it for our 3-video series. Let me know if you have any questions, comments, or concerns. I look forward to seeing you in outpatient. Thanks.